Hello, everyone. Welcome to today's live session, where we will be discussing a topic that affects many individuals as they age: shoulder arthritis. I'm Maitri, your host, and we are fortunate to have Dr. Masood, an expert in orthopedic surgery, with us today. This session promises to be informative and enlightening, so let's get started. Dr. Masood, could you please start by explaining what shoulder arthritis is and what are its different types?
Thank you, Maitri, for this invitation. Before we discuss what's shoulder arthritis, we need to know how does a normal joint work. In our body, the bone ends in a joint are covered by a protective layer called as cartilage. And this cartilage helps us move our joints with ease and without friction. And in arthritis, this protective layer of cartilage is gradually lost over time because of so many causes, and the bone ends get exposed, causing bone-on-bone pain while moving a joint. This essentially is arthritis. There are different types of shoulder arthritis. They can be broadly divided into two categories. Number one is primary osteoarthritis, which we also called as degenerative osteoarthritis, or in simple terms, wear and tear. This type of arthritis occurs in people who are in their 60s or 70s because of the general wear and tear in the joint. Another type of arthritis is secondary arthritis. This type of arthritis has many causes, and it can be broadly divided into inflammatory arthritis, like rheumatoid arthritis or connective tissue disorders, where there is a widespread inflammation in the joints across the body, affecting small joints of the hand, elbows, knees, hips, as well as shoulders. Another form of arthritis, secondary arthritis, is post-traumatic arthritis, which occurs in patients who have trauma, fractures, or dislocation of the shoulder joint. This type of arthritis is commonly seen in younger population after a traumatic event or an insult to the shoulder joint. Next comes rotator cuff arthropathy. This is a type of arthritis where the normal tendons in the shoulder are torn and ripped, and hence the biomechanics of the shoulder changes, causing bone-on-bone arthritis in early 50 to 60 years of patients with irreparable cuff tears. And then there are several other small variants of arthritis, including infective arthritis, where there is an infection in the joint, or arthritis after an arthroscopic surgery, or called as capsulorrhaphy arthritis, and crystal-induced arthritis like gout. Next, we can have arthritis because of decreased vascular supply of the shoulder bone, called as avascular necrosis. It can also lead to arthritis in terminal stages.
Dr. Masood, thank you for explaining shoulder arthritis and its types. Now, could you tell us about the symptoms of shoulder arthritis?
So, coming to the symptoms of shoulder arthritis, it's usually patients come with complaints of pain and stiffness. Pain can be in early arthritis sporadic, or a patient can have pain after an activity, after playing a sports, going to swimming, or doing activities of daily living, or even household chores. The pain can be confined to the shoulder and can sometimes radiate to the neck and even to the elbow. In later stages of arthritis, when there is severe cartilage loss and joint damage, patient can have pain all the time. Even it can disturb their sleep, and patient will have difficulty in completing activities of daily living, such as washing, doing household chores. Patient can also complain of weakness and loss of strength secondary to pain. Another important feature of arthritis is stiffness, which means decreased range of motion. Patient generally comes to the clinic with complaints that they are not able to reach to their neck, to their back, or they are unable to do over-the-head activities or playing over-the-head sports. like throwing.
Thank you for explaining the symptoms, Dr. Masood. Now, let's talk about treatment options. What are the various treatment options available for shoulder arthritis?
Coming to the treatment options of shoulder arthritis, this can be divided into two main categories. One is non-operative treatment and another is operative treatment. Non-operative treatment essentially involves doing no operative intervention, and the first form of a non-operative treatment or a non-surgical treatment is rest. So we advise patients who have early arthritis to rest their shoulder and avoid activities which increase their pain and stiffness. Next, patients can be referred to a shoulder stretching and strengthening program under a shoulder physiotherapist. Next, we can treat this arthritis also with analgesics like paracetamol or non-steroidal anti-inflammatory drugs. But we need to be aware of the fact that excessive use of painkillers can cause gastritis, gastric ulcers, and can cause renal damage or even in some cases renal or kidney failure. Dietary supplements have not been proved of any efficiency or efficacy in shoulder arthritis, and in patients who want short-term pain relief, we can try steroid injections. Steroid injections will not stop the cause of arthritis or the progression of arthritis, but it can control symptoms and patient can feel better, and sometimes we can give about 2 to 3 injections in a year. Again, we have to be very cautious in giving steroid injections around the shoulder because it can itself cause damage to the joint called as cortisone arthropathy, where the cartilage loss becomes profound. So coming to the operative treatment of shoulder arthritis, because of the recent advances in joint replacement surgeries in hip and knee, we can treat shoulder arthritis with shoulder replacement also. So shoulder replacement essentially involves replacing the damaged bone surface with metal and plastic to create a new artificial joint, which can help in achieving a pain-free motion. There are two types of shoulder replacements which we can do in arthritis of the shoulder. One is anatomical shoulder replacement and another is reverse shoulder replacement. Anatomical shoulder replacement involves replacing the ball of the shoulder with a metal ball and the socket of the shoulder with a plastic socket. And a reverse anatomical shoulder replacement involves replacing the ball of the shoulder with a socket and a socket of the native shoulder with a metallic ball. Reverse shoulder replacement is done when the tendons around the shoulder are not functioning properly.
That's helpful information, Dr. Masood. Now, let's dive into the recovery period of shoulder replacement.
Shoulder replacement surgery recovery period depends on several factors, including age of the patient, comorbidities, and what was the cause of arthritis. In general, after a shoulder replacement surgery, patients are kept in the hospital for 24 to 48 hours under observation and are discharged in a sling. Patients are advised to return to the clinic in 2 weeks' time. They are given advice regarding wound care and also regarding physiotherapy instructions by a shoulder physio. At 2 weeks' time, we remove the stitches and advise the patient to wear the sling for another 4 to 6 weeks' time, and we monitor their progress under a shoulder physiotherapy program. At 6 weeks, patients are advised for range of motion exercises, stretching and strengthening. Usually, patients recover very well at 3 months' time. They can drive at 6 weeks to 8 weeks' time and can do overhead activities at 3 months. And there is constant improvement in the pain scores for up to 1 year post shoulder replacement surgery.
Thank you for clarifying that, Dr. Masood. Now let's talk about the recent advances in the treatment of shoulder arthritis.
Regarding recent advances in shoulder treatment of shoulder arthritis, nowadays we are paying attention towards use of orthobiologics in shoulder arthritis and use of platelet-rich plasma, mesenchymal cells. These treatments are still in infancy, and we need to wait for more literature to support their use. But in short term, they have been found to decrease inflammation and help patients recover their range of motion. Also, in terms of surgery, shoulder replacement surgeries are now being done under computer navigation and robotics that helps us to do it in a proper way as per the patient needs and as per the bony anatomy of the patient, helping us to improve our results and the longevity of the implant.
Thank you, Dr. Masood, for highlighting these advancements. Are there any lifestyle modifications that individuals can make to improve their shoulder health and manage the condition effectively?
So regarding lifestyle modification and arthritis is a progressive disease. So there are several factors which are not modifiable, and other factors which are modifiable. Non-modifiable factors like age, genetics, and gender we can't change, but modifiable factors like doing exercises, strengthening your shoulder joint, having a proper diet, and in case of secondary cause of arthritis, taking a proper treatment under physician's supervision. Like patients who have rheumatoid arthritis can be treated with disease-modifying anti-rheumatic drugs, and this can decrease the chances of progression of the arthritis over time. And in case a patient doesn't understand about the shoulder pain, it's always better to speak to a shoulder specialist who can address their causes, concerns, and give them a proper plan for their pain and arthritis. Thank you.
Thank you, Dr. Masood, for sharing your expertise on shoulder arthritis with us today. It's been an enlightening discussion, and we appreciate your insights into this important topic. Any message for viewers?
My last message for the viewers is that you should always maintain a healthy lifestyle, do stretching exercises to keep yourself fit, and always if you are facing any sort of shoulder pain, you can always consult a doctor who is happy to help you. Thank you, Maitri, and thank you, viewers, for joining today. All the best.
Before we conclude, I'd like to extend a heartfelt thank you to all our viewers for joining us today. Your interest in learning more about shoulder arthritis is truly appreciated. We hope you found this session informative and helpful. Remember, knowledge is a powerful tool when it comes to managing your health. Thank you once again, and take care.